Good morning, everyone. Thank you for coming today and welcome to the interview session for the nurse position at RCMP Hospital.
We will begin with a short introduction for each candidate. Please tell us about yourself and why you are interested in working here.
Assalamualaikum and good morning everyone. My name is Nur Syafiqah binti Muhammad Rabuan. I recently graduated with a diploma in nursing at Unicel RCMP. I completed clinical rotation in medical and surgical ward where I developed strong basic nursing skills. I am passionate about patient care, teamwork and I'm eager to grow as a professional nurse.
Assalamualaikum warahmatullahi wabarakatuh. Hello, my name is Nur Zulaika binti Umar Shoki. I hold a diploma in nursing and have experience volunteering as a medic during a marathon event. The experience helped me learn how to respond quickly in an emergency and work well under pressure. I am highly motivated and ready to contribute to patient care.
Hi, Assalamualaikum and good morning everyone. My name is Nuraina Najwa Zulfa binti Abdul Muttalib. I completed my diploma in nursing last year. I consider myself empathetic, responsible and committed to providing safe and compassionate care. I believe good communication and teamwork are very important in healthcare.
Okay, so we'd like to know more about your motivation. So why did you choose RCMP Hospital as one of your hospital options? Shavika, please start.
For me, I chose RCMP Hospital because of its strong reputation for patient-centered care and professional nursing standard. I am interested in working in an environment where teamwork and continuous learning are encouraged. I believe RCMP Hospital will help me grow both professionally and personally.
Okay, so next is Zulaika. What attracted you to CMP hospital specifically? As you guys can see, SCMP Hospital is known as for its organized system and commitment to quality healthcare. I am also attracted to hospital training opportunities for our new nurses. I believe the hospital will allow me to build a strong clinical skill while contributing to patient safety and care.
Okay, so Aina, why did you choose this hospital instead of other hospitals?
I chose RCMP Hospital because of its positive working culture and focus on teamwork. I believe the hospital values professionalism and compassion, which align with my personal value as a nurse. I feel that this is a place where I can learn, contribute, and grow.
So what do you think make RCMP hospital different from other hospital?
For me, I think RCMP Hospital stand out because of its strong emphasis on patient safety and then teamwork and also continuous improvement.
Okay, so how do you think you can contribute to RCMP Hospital as a staff nurse?
For my opinion, I can contribute by providing safe and compassionate patient care, following the hospital policies, and working well with the healthcare team. Aina, if you are offered a position here, how long do you see yourself staying with this hospital?
If given the opportunity, I would like to stay long term. I hope to grow with the hospital, gain experience, and contribute meaningfully to its goals.
Okay, so I'm going to start by asking some general nursing and professionalism questions. So, Shafika, nursing can be very demanding. How do you manage stress during busy hospital shift?
I manage stress by prioritizing my tasks, stay organized, and focusing on patient safety. And then I also communicate with my team when I need help and make sure to take short break when possible to stay focused.
So what do you do if you feel overwhelmed during a shift?
I think I will inform my senior nurse, ask for guidance, and make sure my responsibilities are managed safely.
Okay, good answer. For Zulaika, how would you handle a patient who is uncooperative or refuse treatment? Thank you, Miss, for your question. First, I will listen carefully to the patient concern, explain the treatment in a calm and respectful manner, and ensure that we understand the benefit and risk. If they still refuse, which is patient still refuse, I will respect their decision and document it properly. And the last one, I will inform to the medical team.
So what if the patient becomes angry or aggressive?
I will remain calm, avoid arguing, and ensure my own safety and seek help from a senior staff if necessary.
Okay, good answer. So this question goes to Aina. Why did you choose nursing as your career?
I choose my nursing as my career because I want to help people during difficult times, being able to provide comfort, care, and support to patients and their families. It's very meaningful to me.
Aina, what personal quality do you think are most important for a nurse?
I think empathy, patience, responsibility, good communication skill, and the ability to work well in a team.
Okay. Okay, Shafika. Imagine you are caring for a patient who suddenly complain of chest pain. What action will you take?
I would immediately assess the patient's vital sign and ensure they are comfortable and stable and inform the doctor. And then, if necessary, I would provide oxygen and then prepare emergency equipment and monitor the patient closely while documenting everything. And then I will check the patient ECG if any abnormalities.
So what sign would you look for to determine if the situation become more serious?
First, we can see the patient look like shortness of breath, abnormal vital sign, sweating, dizziness, or changes in consciousness.
Okay, so this question goes to Zulaika. How do you ensure infection control in your daily nursing practice?
I will practice proper hand hygiene, use personal protective equipment correctly, follow isolation precaution when required, and ensure proper disposal of medical waste. I also educate the patient about the I also educate the patient and visitors about the infection prevention.
So, infections control so important in hospital? Why?
Yes, it is important because it helps prevent hospital acquired infection and protect both of patient and healthcare workers.
So, Aina, can you explain the step you take when administer medication?
I follow the steps like administration medication. First, right patient, second, right drug, third, right dose, fourth, right route, and last, right time. And I check the patient, verify the prescription, explain the medication to the patient, and lastly, observe for any side effect after administration.
So what would you do if you notice a medication error?
I will report it immediately to my supervisor, monitor the patient, document the incident, and follow hospital policy.
Okay, so now we will move on to scenario-based question. So imagine you are on duty and a patient suddenly collapses in the ward. So what would you do first?
From my side, I will assess the patient responsiveness and then call for help. And I check the patient airway, breathing, and circulation. And if need, I will start the CPR.
What if you are alone at that moment?
I would shout for help while starting basic life support immediately, which is the CPR.
So, Zaika, imagine a patient suddenly develop a high fever after surgery. How would you manage this situation?
From my side, I will check the vital sign, assess the surgical site, and report to the doctor. I administer the medication as prescribed and monitor the patient closely.
Okay, so this situation goes to Aina. Imagine a family member is unhappy with the care provided and also complains to you. So how would you handle it?
I think I would listen respectfully, remain calm, apologize if necessary, and explain the situation clearly. And also inform my seniors and ensure the concern is addressed properly.
Okay. So how do you see yourself in 5 years? Shafika, please start.
For the futures in 5 years, I see myself as a competent and confident nurse with a strong basic clinical skills. And then I hope to gain experience, continue learning, and contribute positively to workplace.
So Zulaika, how about you?
For my future in 5 years, I hope to be a responsibly and successful nurse with a stable work experience. I want to improve my skill, handle challenge well, and grow both of professionally and personally.
So Aina, your turn.
In 5 years, I see myself as a skilled and compassionate nurse. I hope to gain more clinical experience and possibly further my studies to specialize in a specific area of nursing.
Okay. So thank you for your thoughtful answer. Before we conclude, we will like to give each candidate the opportunity to ask questions.
Thank you. I would like to ask about the orientation and training program for newly hired nurses. How long is the orientation period and what does it usually involve?
Okay, thank you for the question. So to answer your question, our orientation program typically lasts about 3 to 6 months, depending on the department you choose. So it includes hospital orientation, supervised clinical practice, and also guidance from senior nurses to ensure new staff feel confident and supported.
Oh, that sounds great. Very helpful. May I also ask, will new nurses be assigned a mentor or preceptor during this period?
Okay, for this question, yes. Each new nurse is assigned a preceptor who will provide guidance, feedback, and support during the internal months.
Oh, that's reassuring. Reassuring, sorry. One more question. How does the hospital support nurses in continuing education or skill development?
So we encourage continuous learning through in-house training, workshop, and also opportunities to attend external courses. Nurses who show commitment are also supported in further studies.
Thank you.
Okay, thank you, Shafika. Zuleika, you may proceed with your question.
Thank you, Miss. I would like to know about the work schedule system. How are shifts arranged? How does the hospital manage the night duties?
Okay, so to answer your question, we use a rational shift system, including morning, evening, and night shift. So the schedule is planned in advance to ensure fairness and adequate rest time.
Wow, that's good. No, that's good to know. How does the hospital support nurse in maintaining work-life balance, especially with rotating shift?
Okay, we try to balance workload, provide sufficient rest day, and encourage open communication. Yes, also nurse can discuss schedule, concern with their nurse management when needed.
Thank you, Miss, for your question. My final question is about career progression. What opportunities are available for nurses who perform well?
So high performing nurses may be considered for senior staff roles, specialized units, and also leadership position, depending on experience and the qualifications.
Okay, so next, thank you, Zuleika. Aina, please go ahead.
Thank you. I would like to ask about the teamwork culture in the ward and how do nurse, doctors, and other healthcare staff usually work together?
So you don't have to worry about that. We strongly emphasize multidisciplinary teamwork. Nurses, doctors, and allied health professionals communicate closely to ensure safe and effective patient care.
That's encouraging. How does the hospital handle conflict or misunderstanding among staff?
Good question. Okay, we promote professional communication and address issue through proper channel. Nurse manager are trained to manage conflict fairly and constructively.
Thank you. My last question is, what qualities does RCM Hospital value most when newly recruit nurse?
So we value professionalism, willingness to learn, good communication skills, and also responsibility and compassion toward patient and colleague.
Thank you very much. I appreciate the clear explanation.
So thank you everyone for your excellent questions and active participation for today. It was a pleasure meeting all of you.
Okay, so we will review all candidate carefully and contact you regarding the outcome. Thank you again for your interest in RCMP Hospital.
Thank you for the opportunity.
Thank you.